Hello, everyone, and welcome to another session of Next Saviours Must Know series. Today, we are going to have a discussion on a topic that could be life threatening for some, that is, blood in sputum, also known by the name of hemoptysis. So, what exactly we'll be talking under this topic, hemoptysis? One are the causes. As you know, majority of the times the causes are pulmonary, but apart from pulmonary, it could be cardiovascular and others. So basically, we'll be talking about what are the important causes which results in hemoptysis. Second is the pathophysiological mechanism. That means what sort of the arterial venous bleed that results commonly in hemoptysis. Like it could be pulmonary vessels or it could be the bronchial vessels. And we will come to know what exactly is the pathophysiology behind it. The third, obviously, is the management. Means not only you have to manage the underlying cause, but also you have to manage the bleeding itself. So, what are the parameters in order to control this bleeding? And finally, how the bronchoscopy is mandatory or how bronchoscopy is so very much important in order to manage the patient having moderate to severe bleeding. So, this is going to be the tags under the topic under which we are going to have a discussion on this topic, that is hemoptysis. So before beginning with the causes in particular, let's have a discussion on the pulmonary causes and how these questions are going to be framed in your examinations. Like a 30-year-old female presented with a chronic productive cough for the past several months. Now, as I told you that there could be multiple causes leading to this condition, but each and every cause is going to be have a clinical hint on the basis of which you will be making the correct answer. Here, one of the hint is a chronic productive cough. Now, she reports bringing up the large amount of thick, purulent sputum. That is a second hint which is provided to you in the question, sometimes with the streak of blood. So, this is the topic that we are already talking about, which is hemoptysis, especially in the morning. Now, she has had multiple respiratory infections since childhood. On examination, she has clubbing of the fingers. Now, by this time, you already know that what is the diagnosis we are talking towards, and coarse crackles over over both the lower lung zones. Now, chest X-ray shows the typical tram track opacities, and which of the following is the most likely cause of her hemoptysis? So, this question is just a sample for you to identify that what could be the possible reason, because this is how specifically are the questions asked in relation to the hemoptysis. So, as we have talked about that, first what we will be talking is the causes for hemoptysis, and one such cause are the pulmonary causes. Now, under the heading of the pulmonary causes, the first one obviously is the tuberculosis. You know, every time in practice, when you see a patient having sputum along with cough, then we tend to make the diagnosis of tuberculosis. But how would it be provided to you in the question along with several of the hints? Like there will be a history of chronic cough along with fever, night sweats, means all the constitutional features of the tuberculosis along with weight loss and apical infiltrates on the chest x-rays. So this is going to be the hint along with the hemoptysis in order for you to make the diagnosis of tuberculosis. Now, what would be the hint for bronchiectasis? As you know, there will be chronic cough with large amount of purulent sputum along with the history of recurrent infections. So if we go back to the question that what in the form of a sample which was provided to you, you can see that all these are the clinical features which are associated with the bronchiectasis. So here the cause for hemoptysis is bronchiectasis, which is mentioned to you in the question. Now, for bronchitis, what would be the hint provided to you? Would be the small streaks of blood in sputum during the upper respiratory tract infection or chronic obstructive pulmonary disease exacerbation, which is often self-limiting, and this is obviously not the commoner cause for hemoptysis, this bronchitis. Then obviously are the pneumonia, where there would be a history of fever with pleuritic chest pain, with purulent sputum, if at all it is present, with crackles on auscultation. Now, another very important cause for the hemoptysis as a pulmonary cause after tuberculosis is the lung cancer, particularly the squamous cell cancer. Now, how the presentation, clinical presentation is going to be for lung cancers? Like it will be painless hemoptysis along with the constitutional features like weight loss, the history of smoking, and when if the chest x-rays or the CT scan is given, then it would be a mass would be evident on the CT or the chest x-rays. So this is how the clinical features of hemoptysis due to lung cancer would be provided to you in the question. Then the features of pulmonary embolism, the pulmonary embolism features like sudden onset dyspnea, pleuritic chest pain, with a classical feature of hemoptysis in the form of bright red and small in amount, if at all provided to you in the question, with the risk factors like DVT, then answer for that question would be pulmonary embolism. Then in case of fungal infections or aspergilloma, may cause massive hemoptysis in all tubercular cavities. So CT scan will show a fungal ball. While in case of pulmonary infarction, the hint provided to you is going to be a hemoptysis due to the necrotic lung tissue. So these are the pulmonary causes for hemoptysis. Practically, it is the tuberculosis which is very commonly observed. Then after tuberculosis, it is the lung cancer, and the third thing that you have to consider is the bronchiectasis. Next are the cardiac causes or the cardiovascular causes, and how the question related to this cardiovascular cause for hemoptysis would be given. Like a 35-year-old female presents with intermittent hemoptysis, which is progressive along with the along with the history of progressive exertional dyspnea and palpitation for the last 6 months. On auscultation, there is a loud first heart sound and mid diastolic murmur, best heard at the apex of the left lateral decubitus position. So all these features are pointing towards mitral stenosis. ECG shows left atrial enlargement and the chest X-ray reveals straightening of the left heart of the border. So what is the likely cause of hemoptysis in this patient? Then answer for that question is mitral stenosis. So reciprocative way to understand what are the important cardiovascular causes for hemoptysis, one obviously is the mitral stenosis. So you see, if the examiner decides to give any cardiovascular cause for hemoptysis in the question, then the hints would be provided to you for mitral stenosis. Obviously, would be the features of raised pulmonary venous pressure, like rupture of the bronchial veins leading to hemoptysis. There could be associated dyspnea. There could be orthopnea. There could be palpitations and loud S1. So these are going to be the hint for you in the question related to hemoptysis because of the mitral stenosis. Now, in case of pulmonary edema, which is because of the heart failure, there is going to be a presence of pink frothy sputum along with the features of the heart failure like dyspnea, orthopnea, crackles, and cardiomegaly. Now, the reason for hemoptysis and pulmonary hypertension is because of the rupture of the dilated bronchial arteries. So, associated with the right heart strain symptoms. So, what the examiner would be provided to you are the features of the right heart strain features. So, these in particular are the three important reasons which are associated with the cardiovascular abnormality leading to hemoptysis. So first thing that we have talked about was the pulmonary causes and what are the hints that could be provided to you for the identification of that particular option. And second are the cardiovascular causes. Now, after having a discussion on the cardiovascular and the pulmonary causes, the third cause could be the ENT or the upper airway or the other miscellaneous causes. How? Like, if you look at this question, like a 29-year-old male presents to the emergency with the acute onset of hemoptysis, shortness of breath, and fatigue. He also reports tea-colored urine for the last 2 days, and he is a non-smoker with no history of tuberculosis or trauma. Vitals is stable, oxygen saturation is 90, bilateral basal crackles are there, chest X-ray shows bilateral patchy infiltrates, and urine analysis reveals proteinuria and hematuria with the red blood cells cast. Now, serum creatinine is elevated. ANA and ANCA tests are negative, but anti-GBM antibodies are strongly positive. So, what is the most likely diagnosis for this particular case? Now, as you know, this case over here, because of the presence of these findings in the form of ANA and ANCA, is not pointing towards the pulmonary or the cardiovascular causes. So there could be other reasons for the hemoptysis too. Like now you already know, like if there is nasopharyngeal bleeding, like in case of epistaxis, so this could be one of the cause, but we are not going to talk about these non-organic causes. One is the anticoagulant therapy. You know that easy bleeding, including from minor mucosal injuries, history of warfarin. So it could be a reason for these kind of the hemoptytic abnormalities. Other one is the coagulopathy, where there is a increased bleeding tendencies, thrombocytopenia, and disseminated intravascular coagulation. But the two important syndromes which are associated with hemoptysis are the good posture syndrome, where there will be a history of hemoptysis along with hematuria. That means there is involvement of both renal as well as pulmonary involvement. And the other one is the Wegener's granulomatosis, where there will be a history of hemoptysis, nasal ulcers, renal involvement, and CANCA positivity. So, on this basis, you can very easily identify that the answer for the question that we have discussed is the good posture syndrome. So, here we have talked about the causes. As I told you that the causes would be categorized into three. That one is the pulmonary cause, the most important one. Other one are the cardiovascular causes, and there are several other causes also for hemoptysis. So, as a cause, it is something that is extremely important for you to remember. Now, the second obviously is the pathophysiological mechanism. Now, imagine if I give you one question related to this in the form of a sample, like hemoptysis most commonly results from bleeding which is originating in which of the following vascular systems and why? So they are asking a direct question where one of the options has to be correct. Now, if you look at the options, then one is the pulmonary arterial system involvement, two is the bronchial arterial system involvement, third is the pulmonary capillary bed, and fourth is the bleeding from the bronchial venous plexus. So here we'll come to know that where exactly this bleeding is happening in. So you see that the blood supply of the lungs is from two sources, and these two sources are one is the pulmonary circulation, which is a low pressure system. Why is it a low pressure system? Because the pressure is generally kept around 25 to 10 millimeters of Hg. On the other hand, the another circulation system is the bronchial circulation. Now, this bronchial circulation is considered to be a high pressure circulation system. Why high pressure? Because it is originating directly from the aorta and is supplied oxygenated blood to the bronchi, pleura, and the connective tissue. So, pressure is almost similar to the systolic pressure, which is high. And you see, out of these two sources, that is pulmonary circulation and the bronchial circulation, it is the bronchial circulation which is the main source of hemoptysis. Why? Because of they are having thin walls, they are tortuous, and they work under high pressure. Now, as you can see that out of the sources from which the hemoptysis can happen, it is the bronchial arteries which is having a higher pressure, and it is the main source of bleeding in hemoptysis. Now, how these vessels gets irritated and how these vessels gets infiltrated. For example, as we have talked about that tuberculosis is one of the main reasons for this hemoptysis to develop. So what happens that the caseating necrosis, it erodes the bronchial vessels in the upper lobes, resulting in hemoptysis. Now, bronchiectasis, it results in dilated and inflamed airways. So these sort of the airways, it becomes fragile, leading to a fragile blood vessel too. So it results in bleeding. In case of squamous cell carcinoma of the pulmonary system, the tumor, it directly invades or it erodes the blood vessel. Now, what happens in one of the cardiovascular cases like mitral stenosis, that because of the increased pulmonary venous pressure, there will be a rupture of small vessels. Now, in case of pulmonary embolism, what happens? There will be infarction, and this infarction will result in necrosis. This necrosis will result in the hemorrhage into the alveoli. As we have talked about that this aspergilloma, it grows in old tubercular cavity and it also is responsible for eroding the blood vessel. So usually what happens in as a end result, that the final common pathway, what happens is that this high pressure blood, it leaks into the bronchial tree and it irritates the mucosa, and because of this irritation of the mucosa, there will be stimulation of the cuff reflex, and this cuff reflex will result in cough obviously. So this collected blood can be seen in the sputum or come out as along with the cup. So this is the basic pathophysiological mechanism for each of the individual diseases that results in hemoptysis. And then finally, it is all about what is the next best step in the management of the hemoptysis. Like any question, a long clinical question which could be provided to you by the examiner whenever asking about the management related to hemoptysis is potentially asking a question on bronchoscopy. That means they want you to answer the question in related to the bronchoscopy. So let us see what all is required for you to learn, or in order what is all required for you to remember about the bronchoscopy. Now you see, bronchoscopy is for the direct visualization of the any abnormality, and it is used for both diagnostic as well as therapeutic purposes. So what are the diagnostic indications for bronchoscopy? Now imagine if the patient is suffering from unexplained hemoptysis, particularly if the chest X-ray is absolutely normal, then you have to look for, visualize for that where exactly this lesion or subtle bleeding site is there, so that it can be managed. Another indication is to localize the site of the bleeding, particularly useful in moderate to massive hemoptysis, not only for making the diagnosis but also for intervention. If there is a suspicion of malignancy, then this endoscopy not only helps you to directly visualize but also will help you out in taking the biopsy of suspicious lesion in chronic smokers in particular. Another indication is when you are suspecting tuberculosis or fungal infection, then obviously you need a tissue directly for AFD smear, fungal culture, or the gene expert, which can be obtained by bronchoscopy. Now, if the patient is having a normal HRCT, but there is a persistent hemoptysis, then again you have to uh, visualize the small endobrachial lesions, which could be a carcinoid or the vascular malformation. That for the purpose, the diagnostic bronchoscopy can be used. So another indication for bronchoscopy is a therapeutic indication where it can be used as a therapy. How? One is control of the active bleeding. You know, bronchoscopy can be used directly to stop the bleeding from bleeding several methods, like a cold saline lavage in order to cause the local vasoconstriction. Then by topical application of vasoconstrictors like adrenaline or phenylephrine. It can also be used for the provision of balloon tamponade to compress the bleeding vessel, and if there is a availability, then laser therapy or electrocauterization can be used to coagulate and seal the bleeding point. So this is one indication where you can control the active bleeding. Another one is clearing the airway of the blood clots. How? In a patient with moderate or massive hemoptysis, there could be an accumulation of the clots in the airway, which can obstruct the ventilation. Now, bronchoscopy can help remove this clot, which improves oxygenation and reduces the aspiration of the reduces the risk for the aspirations. And then finally, that it can also be used as a bridge before definitive therapy. How? That bronchoscopy is often used as a temporary stabilizing measure before the patient undergoes more definitive treatment like bronchial arterial embolization or the surgical resection. So this bronchoscopy can help you buy time and localize the bleeding site for the interventional planning. The moment we have talked about the indications, there is a never ending debate in where to use the rigid or the flexible bronchoscopy. And you cannot come to the conclusion until and unless you don't understand the advantages and disadvantages of the rigid and flexible bronchoscopy. Now, you already know that the rigid bronchoscopy is a straight metallic wide bore tube, while flexible bronchoscopy is a thin fiber optic, which is a flexible scope. Now, obviously, the anesthesia which is required for performing this rigid bronchoscopy is the general anesthesia, while bronchoscopy can be done under sedation or local anesthesia. Now, where what is usually accessible while performing this rigid bronchoscopy is trachea and the large bronchi only, while flexible endoscopy can reach the segmental and even the subsegmental bronchi. So it is having an advantage over here. Now, visualization, that rigid bronchoscopy is good in large airways for visualize, in order to visualize with the limited view in periphery. But the flexible bronchoscopy is excellent in peripheral lung field visualizations. As far as bleeding control is concerned, rigid bronchoscopy is superior in suctioning. It allows control of massive hemoptysis, while the flexible bronchoscopy can manage mild to moderate bleeding only. So, for the control of bleeding, rigid bronchoscopy is having an advantage over the flexible bronchoscopy. Another one is the instrumentation. You know that rigid bronchoscopy, it allows the use of rigid instruments like cautery or the laser, and that is the reason why it can be used for the management of the large bleeding vessels. While in case of flexible bronchoscopy, it is having a provision for limited instrumentation, which can be used for the purpose of biopsies and lavage only. Airway patency, that rigid bronchoscopy, it maintains airway during the large bleeds also because of having a wider bore tube, while flexible bronchoscopy cannot maintain the airway during heavy bleeding. Now, as far as this use in massive hemoptysis is concerned, as we have already talked about, that rigid bronchoscopy is a first choice due to airway control and for the ease of suctioning, while flexible bronchoscopy is not at all preferred because of the risk of the airway obstruction. The diagnostic uses, it is less ideal for small lesion than rigid bronchoscopy, while the flexible bronchoscopy is best for the bronchoalveolar lavages, the brushings, the biopsies of the peripheral lesions. For the therapeutic uses, the foreign body removal can be conducted by rigid bronchoscopy. The tumor debulking can be done. Stent placement can be done by rigid bronchoscopy, while lavage, biopsy, and mild bleeding control can be achieved by flexible bronchoscopy. So, hope you have understood everything in relation to this topic, that is hemoptysis. All the best for your future examinations. In order not to miss any update, please join our Telegram group. The link is provided to you in the description. Thank you.